Well, I get a lot of interesting comments on my channel, and some of them are quite angry. And recently I've had several angry comments, and my initial response was to be aggravated. But then I thought about them for a while, and I realized that the commenters had some points. So I want to address the points in this video, and I hope it will help people who are in the disability application process. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams. I've been doing them since 2017, and as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, the reason I started this channel was actually to help doctors who were new to the disability exam process. Disability exams are quite different from the typical exam a doctor would do in the office or the hospital. In a typical medical exam, the two main questions in the doctor's mind are, what is the diagnosis? What's the cause of the patient's problem? And what is the treatment? How can I help the patient resolve their problem? And if they're already being treated, is the treatment working or not? It's rare that a doctor in the office or a hospital is thinking about the person's ability to work or long-term disability. And when it does come to the ability to work, it's usually short-term, such as a person with pneumonia. The doctor might give them 10 days or 2 weeks off work, but they're not thinking about somebody who's permanently disabled or not. So, a disability exam is usually a new and confusing experience for patients, and it's a new and confusing experience for doctors who are new to disability exams. And my first videos were my advice to new doctors doing disability exams. However, I found that my main audience was patients who were applying for disability. And what I had seen doing disability exams was that many patients did not know what sort of information or behavior was helpful in a disability exam, and would often give unhelpful information, which frustrated them and also frustrated me. So I decided to make videos aimed towards patients. And if you find this sort of thing interesting, you might want to subscribe to my channel. I generally put out one disability-related video every Friday morning. So, the main purpose of a disability exam is for the person to describe and demonstrate their medical problems that limit their ability to work. And those problems can be physical, psychological, or a combination of both. In both a normal doctor's visit and a disability exam, communication between the patient and the doctor is absolutely key. However, there are some differences. In the office or hospital, I would often see a person more than once, sometimes many times over a period of years. In a disability exam, I usually see the person only once for a limited period of time, about half an hour. Now, the first angry comment I've gotten, and I've had this repeatedly, is people who are very offended by the fact that I advise patients to not use medical terminology, to describe their problems in layman's terms. They feel that I'm insulting their intelligence, that they have full knowledge of medical terminology and should be able to use it at their disability exam. Well, here's the problem from my point of view. I'm sure there are some people who really do know medical terminology and use it appropriately. My issue is that because I see people only once and for a limited period of time, it's almost impossible for me to sort out the people who do know the terminology and use it appropriately from the people who don't. Quite a few of the people I see in disability exams who attempt to use medical terminology are not using it correctly. And that's frustrating for me, and it reduces their chances of being approved. Whereas if they describe their problems in common layman's terms, I'll know exactly what they mean, and they'll have the best chance of being approved. Sometimes even doctors or nurses use medical terminology incorrectly. Last month, I was reading a book on neurology, and I was chagrined to find out that I'd been using the term Lessegs sign incorrectly for years, maybe even decades. I'm occasionally surprised by how accurately patients who aren't medically trained do use medical terminology. For example, when I worked in the emergency department, I had a woman in her 30s come in and tell me that she thought she'd had a ruptured blood vessel in her brain. I examined her and ordered a CT scan of her brain, and sure enough, she was correct. She had a ruptured blood vessel in her brain. But that sort of thing sticks in my mind because it's rare. Like I say, I really don't have time to evaluate a person's level of medical knowledge. And I see quite a range of education and intelligence and ability to think in disability exams. The least educated person I've seen finished school at grade 3. And then I've had several people with doctorate degrees. So again, if you want to communicate with the doctor, that's the best way you're going to give yourself the highest chance of your disability application being approved. And from my point of view, the best way to communicate is to use common layman's language. I don't advise that because I want to belittle you or insult your intelligence. I say that because I want you to have the best chance of your disability application being approved. Here are a couple of other barriers to good communication between the patient and the doctor. Some people come in with prepared written notes and want to read everything from their notes. Other people come in with a friend or relative, and when I begin taking the medical history, the friend or relative wants to do all the history giving and answer all the questions for the patient. As well as evaluating patients physically, my job is also to evaluate them mentally. Can they remember? Can they think? And it's impossible to do that if all the answers are read or given by another person. It's best if at least initially the person tries to answer my questions themselves. If it's clear to me that they're having difficulty with memory or they're confused, then I may have them read from a paper or get a friend or relative to help me with the history. Here's an example. A man in around age 40 was brought in by his mother. He'd been in a terrible accident and had sustained a very serious brain injury. He'd been in a coma for a long time and had needed brain surgery. Initially, his mother started to do all the talking for him, and I explained to her that I really needed to evaluate her son's mental capacity. So I began talking with him, and it was clear that he wasn't all there. I would estimate that his mental capacity was about that of a 6 or 7-year-old. So after a while, I did direct some of my questions to the mother, and she was very helpful. This allowed me to put in my report that the patient had serious problems with his memory and thinking, and I'm sure that went a long way towards getting his disability application approved, which was his and his mother's goal. Now, the second angry comment I've gotten is about medical records and my advice to not bring medical records to a disability exam. So I want to describe in detail what happens and what doesn't happen with medical records during a disability exam. Prior to the day that I do disability exams, Social Security sends me what they call a CE packet on each person that I'm going to see. And the CE packet contains a sample of their medical records, not the full medical records, what Social Security thinks is important, and also a list of the disabling conditions that the patient's reported to have. And for each person, I go through their CE packet and make notes. One of the things that I don't think patients really understand is that a lot of the medical record is totally useless for a disability exam. For example, if you are admitted to the hospital, there will be pages and pages and pages of nurses' notes giving the blood pressure, temperature, pulse, etc. at various times a day, recording whether the person urinated or had a bowel movement, recording whether they got Tylenol for a headache, etc. And it takes quite a bit of time to go through the medical records and pick out what's important. Likewise, sometimes people bring in stacks of medical records, 1,000 pages or more, stacks 6 inches high or more, and expect me to either have already read the entire record or to go through them at the exam time. And that's simply unrealistic. The best thing to do is to describe in your own words your problems and how they limit your ability to work to the best extent possible. I generally don't look at medical records that people have brought in. There are occasional exceptions. I've had times where there was something quite important that the patient tried to describe but really couldn't describe accurately, and I really thought that a brief glance of the medical record would clarify things for me. And there are occasionally test results that can be really important and really influence my decision. And in circumstances like that, I may go through the medical records briefly, but I'm not going to read a 6-inch stack of medical records during a disability exam. If I did, I'd only be able to see one disability exam patient per day. The other thing about medical records is when a person applies for disability, Social Security gets their medical records, their complete medical records, and personnel at Social Security go through them all. And often they make a decision to either approve or deny the claim based on the medical records alone. When they send a person for a disability CE exam, when they send a person for me, it's generally because the information they need to make a decision is not in the medical records. So if the information they need isn't in the medical records, me looking at the medical records is not going to make that information magically appear. It's far more likely that I'll get the important information by talking to and examining the person. And then finally, I get some people very put out because I won't look at their MRIs during the disability exam. Well, here's another thing people need to know. If the major problem relates to spinal issues, and if the person's had an MRI of their spine, say the neck or the back, Social Security includes the MRI results in the CE packet. So at the time that I examined the person, I've already reviewed and made notes on their MRI report. So them describing the MRI to me again is not going to help me or Social Security or give us any information that we don't already have. And as I've stated many times before, MRIs provide very limited information about what problems somebody is having with their spine. For example, it's rare that a doctor can tell if somebody's spine hurts based on their MRI. I know many people find this incredible, but it's simply a fact. So, in conclusion, please keep the comments coming. Even the angry ones I'll try to respond to. In my opinion, if you want to have the best chance of your disability application being approved, before your disability exam, think about your entire body from head to toe and all the issues that you have that limit your ability to work. And then at the exam, describe those problems in your own language to the doctor, and then have the doctor examine you to document those problems. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.